Do you frequently feel like your heart is racing, even when you're just sitting down? Or maybe your face often looks unusually red, and people keep asking if you're overheated. These might not just be random changes. They could be signs that your body is making too many red blood cells. This is what happens in a condition called secondary polycythemia. Unlike some blood disorders that come from within the blood system itself, this one is the body's response to something else going on, like not getting enough oxygen. Think of it like your body turning up the volume on red blood cell production because it's trying harder to carry oxygen. It's like adding more delivery trucks to a highway because packages keep piling up. But too many trucks cause traffic jams, and in your body, that can mean clots or strain on the heart. So what makes your body say, hey, make more red blood cells? The main reason is not enough oxygen reaching your tissues over a long time. Doctors call this chronic hypoxia. Imagine you're climbing a mountain, the air gets thinner, so your body senses, hey, there's not enough oxygen here. So it tells your kidneys, send out the hormone erythropoietin. That hormone then tells your bone marrow, make more red cells to carry oxygen. That's normal at high altitude. But problems start when this goes on too long or happens in places it shouldn't. Common causes: living at high altitudes for years, smoking, because carbon monoxide from smoke blocks oxygen, having lung diseases like COPD or sleep apnea, where you stop breathing at night. Even rare kidney tumors can send false make more blood messages. It's like a broken alarm that keeps ringing even when there's no fire. Now, how would you know if you have this? You might feel tired, dizzy, or have frequent headaches. Some people notice their skin, especially the face, looks very red, almost like a permanent sunburn. Others find their vision gets blurry, or they feel itchy after a hot shower. Yes, really. That's because too many blood cells make the blood thick like syrup instead of water. That thick blood flows slowly, so your body struggles. You might get short of breath, not just during exercise, but even while talking. Some people develop nosebleeds or bleeding gums because the blood doesn't clot properly when there are too many cells. A patient once said, I felt like my blood was too heavy to flow. That's a good way to think about it. If you're experiencing any of these, especially if you smoke or have lung issues, it's worth mentioning to your doctor. How do doctors figure this out? First, they will ask about your health history. Do you smoke, live at high altitude, have breathing problems at night? Then they will do a blood test. If your red blood cell count and hemoglobin are high, that is a clue. But they will not stop there. They need to make sure it is not the rare primary type, polycythemia vera. So they might check your erythropoietin levels. In secondary polycythemia, those levels are usually high because the body is truly trying to fix low oxygen. To find the root cause, they might do chest X-rays, sleep studies, or check your oxygen levels while you breathe. Treatment: it is not about reducing blood cells quickly, like it is in primary polycythemia. Instead, the focus is on fixing the cause. If you smoke, quitting is the #1 step. If you have sleep apnea, using a CPAP machine at night can make a big difference. In severe cases, doctors might remove some blood, called phlebotomy, but only if needed. Think of it like fixing a leaking pipe by turning off the water source instead of just mopping the floor. Can you prevent it? Absolutely, and it starts with your daily choices. Avoid smoking. It's one of the biggest triggers because it robs your blood of oxygen. If you live at high altitude and notice symptoms, talk to a doctor about checking your blood. Use your CPAP machine every night if you have sleep apnea. Don't skip it because it's uncomfortable. Regular checkups can catch lung or heart problems early. Staying hydrated also helps keep your blood from getting too thick. Think of prevention like routine car maintenance. If you keep the engine running smoothly, you avoid breakdowns. Your body's the same, treat it well, and it will carry oxygen efficiently without overworking. Now, what's new in medicine? Scientists are learning more about how oxygen sensors in the body work. A big discovery was the HIF, hypoxia-inducible factor, Pathway. It's like the body's oxygen control switch. New drugs targeting this pathway are being tested to help manage diseases linked to low oxygen, including secondary polycythemia. Also, better wearable oxygen monitors now let people track their oxygen levels 24/7, like a fitness watch does for steps. This helps doctors catch drops in oxygen during sleep or activity early. One recent study showed that adjusting CPAP use based on real-time oxygen data reduced polycythemia signs in sleep apnea patients. So tech and biology are teaming up to give us smarter, personalized care.